In the year 2000, we came out with a very big report on health system performance, and that generated a lot of heat, a lot of noise, a lot of thinking, and a lot of attention. After that, the focus is very much on health systems, and in a way, I look at this as kind of saying that there was a big push as well in many of us in the health community to really emphasize this whole agenda of what's called HSS, or health system strengthening. And for us, it took off, but for a lot of the political dimension, it didn't really grab people, whereas universal health coverage did. I've raised this sometimes in presentations. Is UHC just a new way to spell HSS? And the answer to me is no. And it's really one of these core points that UHC is about goals. It's about what you're trying to achieve. It is to some extent a repackaging of the health system performance goals that were defined in 2000, not at the same level. So those goals, for example, were fundamentally about improving health and equity in health, as well as financial protection and responsiveness to citizens' expectations. UHC is kind of a subset of that, in a way framed within the SDG, right? So the SDG health goal is about improving health. UHC, in that sense, is a means to that. But it's very politically salient because it's much in what government can promise. I mean, government doesn't improve your health directly, but it may provide health facilities or public health programs or things like that. So I think it has that resonance with people in a way that HSS didn't, because it's about goals rather than instruments. And I think that part is very important. And then in our agenda, the key distinction is saying that it doesn't mean HSS is not important, but HSS is the health system strengthening. So work on health financing, service delivery, those are means to move towards UHC. UHC kind of came into existence after the Second World War, with things like the NHS in Britain, like universal health insurance in Japan, like many countries in Europe. And in a way, it was really this shift from health coverage as an entitlement for employees to a right to health services, a right to doing that, in part because medical technology had evolved and actually this became something really worth having. And you see it then in like Universal Declaration of Human Rights and so on. So in that sense, us coming out with a report in 2010 didn't invent UHC, but it kind of reinvigorated that. And it just has resonated with the politicians in a way that HSS is more resonating with people who work in health systems.